that you're here. And today we're talking about blood pressure. Blood pressure is called a silent killer. It has no symptoms. Often you don't even know you have it until it's too late. 1 in 3 people in America have it, and an additional 1 in 3 people have what's called pre-hypertension, which means they may not even know that you have it. You might not even know you have it right now. This is why whenever you go to your medical provider, they always check your blood pressure. Even though you might be coming in for an ear infection, they always check your blood pressure because it has no symptoms, and we want to make sure that we catch it before it's too late. So if you have blood pressure, someone you know has blood pressure, or wondering if you have blood pressure, this episode is for you. Let's get started. But before I do, I always like to let you know how to reach me and my team. So if you're watching us on Facebook, hello, type the word live. Let us know that you're here. My team will answer you back. If you're watching us on replay, let us know you're here on replay because our team will still answer you. Anywhere you are, type the word change and my team will send you the show notes because it takes a long time to write them. And sometimes they're nice to see. If you're watching us on YouTube, don't forget to like and subscribe. It means the world to us. For those of you listening to me on podcast, hope you're enjoying your chores or whatever you're doing, driving. As always, the set is the same. Today, I'm wearing an orange sweatshirt and always wearing the stethoscope that my wife gave me. Wherever you are, follow us on Instagram because we're funny and share this with the people that you love, people who might be dealing with blood pressure, any of our episodes really, because one of the reasons I produce all this content is so that you can, learn from it, start implementing changes, whether or not you choose to work with me and my team. I really want you guys to have the option of making a change in your life. For those of you who don't know me, my name is Efrat Lamondre, and everyone calls me E. And I invented the new method where we empower people to realize that their symptoms are not in their head because you always knew there was a better way. So join the conversation wherever you are, and let's start talking about blood pressure. So blood pressure, fancy word for blood pressure is hypertension. I always like to start with a definition. It's a condition which the force of the blood against the walls of the arteries is consistently too high. Let me explain it to you a little bit using a plumbing metaphor. So imagine you have a whole bunch of pipes, but these pipes are not, they're soft pipes, kind of like hoses. You have a whole bunch of hoses and pipes, and those are your arteries. And then there's a main pump, that's your heart, some filters, that's your kidneys. And in a healthy plumbing system, the water flows smoothly, the pump is doing great, the filters are doing great, everything is fine. But with high blood pressure, you now have this intense pressure inside this plumbing system, inside this closed system. And the pressure pushes against the hoses, the pipes, causing them to weaken. The pressure makes the pumps and the filter works harder. And any dirt that might be on the pipes, on the inside of the pipes, might get kind of flicked off and now is going to circulate and might get stuck in the pump and in those filters. This is why blood pressure can lead to so many serious health problems like heart disease, stroke, kidney disease. Let's go a little bit deeper to explain why it's so dangerous. Heart disease. High blood pressure can damage the heart and blood vessels. It can cause heart failures, problem with that pump I was telling you about. And because remember I said you could scrape some of that dirt off of the pipe walls, you could get stuck in the heart, which could lead to a heart attack and other cardiovascular problems. Stroke is that same pressure, which now, again, can cause issues with the blood vessels in the brain, right? Because those pipes are everywhere. They're all over your body. Kidney damage, that's those filters I was telling you about. The kidneys filter the waste from the blood. High blood pressure can damage the small blood vessels in the kidneys, leading to kidney disease and kidney failure. Aneurysms. Aneurysms, I want you to think of aneurysms. That's when the pipes, the hoses, have so much pressure in them that they start to expand in certain areas. High blood pressure can cause the walls of these pipes, these vessels to weaken, which is an aneurysm. They can bulge, but then they could also burst, which can cause internal bleeding. If that didn't scare you enough, high blood pressure can also cause dementia. I know every one of us is scared of dementia. High blood pressure in midlife has been linked to an increased risk of dementia. Remember, it's not just the heart. That pipes, all those pipes, they're in here too. So that pressure is going to affect your brain. Vision loss. High blood pressure can damage the vessels, the pipes in your eyes. This can cause vision loss and blindness. And if none of that scares you, you don't care about your brain or anything else, it can also affect your sexual function. maybe that'll get you scared. High blood pressure can cause erectile dysfunction in men and can cause a decreased sexual desire in both men and women. Hopefully, one of these points will get you to understand how serious this is. Because it's so dangerous, it's important that you treat your hypertension. Whether you choose to implement a lifestyle modification or take medication or both, the most important thing is that you do not ignore it. You can't just say, oh, you know what? I don't like meds. I'm just going to keep doing what I'm doing. That's not going to work. You cannot wish it away. You're going to have to choose one way or the other or both and get on top of this blood pressure because it's going to kill you. Now, if you do have it, how do you even know if you have it, right? That's the question. Part of the problem of knowing if you have high blood pressure is, diagnosing it. First of all, you have no symptoms. So you're not even going to know. Second, it can fluctuate. It's supposed to fluctuate all day long. So it's possible that if you go into the office and you have that one reading once a year, maybe it's not the right reading. It might be too high. It might be too low. So just getting one blood pressure reading at the doctor or NP or PA's office is not going to tell you what's going on. You might get really nervous in the doctor's office and have high blood pressure only in the doctor's office. That's called white coat hypertension. You might be really relaxed because you took the day off and you took a nap before you went to the doctor's office, and now we're going to have this falsely low blood pressure. So one reading is not enough. It's important to get an average reading of several days to really get a sense of what's going on. So what's next if you have it, or if maybe it's creeping up, you're not sure, some days it's high, some days it's normal. What do you do? Well, it all depends on how much you're willing to put into it. If you're not ready for a lifestyle change, and I say this all the time for just about every disease process, if you're not ready for a lifestyle change and you just want a pill, then please have your PCP give you the script. The pill will work on the plumbing. Some of the pills help open the pipes up. Some of the pills work on the filters, the kidneys. Some help the pump along. Wherever it is, it can help you bring the blood pressure down. Hopefully, one or more of these pills will bring your blood pressure down, and that's okay. Just get it down. That's really important to get it down. I want to stress, I know a lot of you out there don't like medication. This is not one of those things you're going to mess around with. If you have high blood pressure and you're not ready to make lifestyle modification, go ahead and take the medication. Now, it will bring your blood pressure down, but I want to explain that while it's bringing your numbers down, it's not actually fixing the underlying problem. And if that's okay with you, that's okay with me. At least you're on the medication. You're reducing your risk of bad stuff happening when those numbers are down. But if you want to get to the cause of why it's happening, why do I have high blood pressure? Then we need to dig a little deeper. And if you're willing to do the work, then you can actually make a difference and a lot of times actually reverse the blood pressure. So let's go over the reasons of why people have high blood pressure. First is genetics. Sometimes hypertension can run in families, and certain genes can increase your risk of developing the condition. That being said, excuse me, just because it runs in your family doesn't mean you're automatically going to get it. There are still certain things in your life, as you know, if you watch any of my episodes, that could turn these genes on or off. So just because grandma has it doesn't mean you have to have it. Age. As you get older, the blood vessels, the pipes, they tend to stiffen, which can lead to an increase in blood pressure. Lifestyle. A sedentary lifestyle, a poor diet, excessive alcohol consumption, smoking, all of that can increase the risk for developing hypertension. Obesity, excess weight, especially weight around the waist, can really increase blood pressure. Try to say that fast a few times. Chronic stress can cause an increase in blood pressure. Yeah. Now, I always tell my patients say to me, is it just the stress? We all have stress. Okay. So you don't want to measure your blood pressure in the moment of stress because it's going to be elevated. What we're talking about, if you're chronically under stress and that creates chronic hypertension, yes, that is definitely a factor. Of course, chronic medical conditions, diabetes, kidney disease, sleep apnea can contribute to hypertension. And medications, there are certain medications like birth control, decongestants. If you have a cold and you're taking a decongestant, all that can raise blood pressure as well. So that's the list. And there's a certain part of the list that we can't do anything about, right? Your genes are your genes, your age is your age, but there's a whole heck of a lot of things that we can do about what we call modifiable lifestyle factors, the things that we can change in our life. Now, some of the things are obvious, right? If you're smoking, it's going to increase your blood pressure. Why? Because when you smoke, those pipes get smaller, and that forces the whole body to work harder to pump through. If you have a lot of processed foods all day and you're taking in a lot of sodium and other chemicals, that causes you to retain fluids in the pipes. We're going to talk more about sodium later on, but that increased fluid is going to raise your blood pressure. But you know that we're not going to stop with the obvious and just say, hey, stop smoking and stop eating processed foods. You know, we're going to go a little bit deeper. If you really want to solve your hypertension, we don't just want you to treat the hypertension, right? It's not enough to just treat the hypertension with pills. We're going to treat everything else that causes your hypertension. That's our goal in functional medicine. Why am I having the hypertension? What is going on? What can I do to get behind the why, fix the why, so that I don't have the problem? So let's start with something that may not be obvious to many of you: sleep apnea. If you have high blood pressure and sleep apnea, you have to treat the apnea if you want to get the blood pressure down. It's not going to go down if you're not treating the apnea. So there's 25 million Americans that have sleep apnea, a lot of people, and with that number, there's still so many who are underdiagnosed. And by the way, it's not just a disease of people who are overweight. Most people think sleep apnea is just about being overweight, but you can have obstructive sleep apnea even if you're not overweight, because there could be structural issues here. So pay attention. If your partner says you snore a lot and he or she has to leave the bedroom to get a good night's sleep because you make that much noise, Gina, don't tell anybody I snore, please. If your partner's telling you snore a lot and you're super sleepy during the day, or if you don't wake up rested, and you should consider finding out if you have sleep apnea, because sleep apnea can cause a lot of issues. It's not just about disruption of your sleep, which, by the way, of course, if you don't know, watch my episode on sleep, because if you're not sleeping well, you can also get dementia. Side note, but for now, having sleep apnea can really affect your blood pressure. When you have sleep apnea, it means you're not getting enough oxygen to your body, especially to your brain. And when you're not getting oxygen to those blood vessels, they can't perform they need to, they can't create the energy they need to, they can't contract and expand the way they need to, and that can result in high blood pressure. And of course, all this frequent night waking because you're not sleeping and you're getting up and you're tossing and turning, that increases your cortisol levels all night, which increases inflammation. And that causes something called oxidation, which leads to hardening of the arteries, constriction of those pipes. So this disruption in sleep is more than just about your sleep. It literally affects your arteries, your pipes, which can cause blood pressure. The next thing we have to talk about with blood pressure is insulin resistance. Now, for those of you who don't know, there's diabetes, there's prediabetes, and both of those are measured with A1C. Is your A1C high, then you might have diabetes or prediabetes. But there's also the world of insulin resistance, which starts even before prediabetes. So there are millions of people out there who are insulin resistant, but their A1C is normal. So don't be fooled if your labs are normal. Just because your A1C is normal doesn't mean you're not insulin resistant. So quick note about what insulin resistance means. It means that you are eating more glucose than you need to, eating more food than you need to, which is becoming glucose. When we get glucose in our body, insulin picks it up. It's like Uber, and drives it to the cell. If we didn't eat yet, the cell says, thank you so much. I really need this glucose. I need it for energy. Thanks. Then we eat a little bit more than we need to. Insulin picks it up, brings it to the cell, and the cell says, no thanks, I'm full. And insulin's like, well, what am I supposed to do with this glucose? And it tries to force the cell to take it. And the cell's like, no, thank you, I don't want any. And that is insulin resistance. That insulin resistance causes inflammation. It's not what you want. And then you're going to ask, well, what do we do with this glucose? Insulin tries very hard not to drop it in the blood. If it drops it in the blood, that's diabetes. So it tries it. What it does, it converts into fat. You get belly fat. You can get a fatty liver. You can get cholesterol. I know it's not the point of today's talk, but I want to let you know where that goes. But that whole moment of insulin resistance, insulin trying to force the cell to take it, the cell saying no, causes inflammation throughout your entire body. And because one of the things that it does is create fat cells, the fat cells now create inflammation. So you have all this inflammation, which causes what's called oxidative stress, which really means that it takes those pipes and there's gunk on those pipes. And when we have oxidation, that gunk gets rusty. And that rusting of the gunk on the pipes is dangerous. And so I want you to think of these pipes. They're rusting, they're stiffening, hardening of the arteries. And that all of that is happening because of the inflammation secondary to the insulin resistance. And if your pipes are stiffer, gunkier, rustier, you're going to need more and more pressure to get your fluid through. So insulin resistance is not just a sugar problem. It's not just a pancreas problem. It's not just, oh no, I might get diabetes. It's actually a cause of hypertension. Fix the insulin resistance, and you may be able to fix the blood pressure. Okay. Next thing we have to look at is certain nutritional deficiencies. People who are nutritionally deficient in certain things can cause high blood pressure, like magnesium. Magnesium is one of those things, when I replace it in my patients, they don't even know that they're deficient. Like magical things start to happen. First of all, some of them go to the bathroom regularly for the first time in their life. People's headaches go away. They sleep better. Their muscle twitching gets better. Their cramping goes away. Mood improves. And we also see that blood pressure goes down. Magnesium has a very important role in the body, and it plays a big role in lowering blood pressure. Now, that doesn't mean to take magnesium instead of your blood pressure meds. Please don't tell me, don't do that. Don't say, hey, I heard on your podcast that you said magnesium lowers blood pressure, so I threw away all my blood pressure meds and I started taking magnesium. Don't do that. Please don't do that. I'm just saying, along with all the lifestyle modifications that I'm sure you're going to implement, make sure magnesium is in there. It will help bring down your blood pressure. The other important thing that's often missing in diets is omega-3. Omega-3 fats are, or like fish oil, helps your blood vessels relax. So it opens them up, right? Because stiffening means that it's high pressure. If you open them up, they can relax. They're more pliable. So omega-3 helps with that. And of course, this would not be a Dr. E episode if I didn't tell you that somehow in all of this, the gut microbiome is part of it. And of course it is. If the gut microbiome is altered because of our standard American diet, processed diet, medication, it can cause inflammation. And you already know that inflammation dries up high blood pressure. So if you are going to manage your blood pressure, you also need to manage your microbiome. And if your microbiome is off, not only does it cause inflammation, but now you're also not absorbing your minerals, your nutrients. And when you don't absorb vitamin D, potassium, calcium, magnesium, these are all the nutrients that we need to help regulate our blood pressure. So no matter what episode you listen to, I'm going to tell you, you have to fix your microbiome. Sorry, no shortcuts. Believe it or not, for people who, for a lot of people, gluten sensitivity can also be an issue for blood pressure. And I'm not just talking about celiacs. I'm talking about the whole world of what we call NCGS, non-celiac gluten sensitive. If you are a person who is sensitive to gluten and you eat it, it will cause inflammation, which of course increases the blood pressure. So be aware of that. So sometimes just cutting out the processed food, taking out the dairy, starting some good quality supplements, and you suddenly start to see a quick decline in blood pressure within 10 days. Now, remember when I say gluten-free, I don't mean go outside and buy gluten-free Oreos. I mean good quality food that don't have gluten in it. I get really nervous when I say gluten-free because you could fill up your whole pantry with gluten-free nonsense. I don't mean that because that's still processed and it's still going to drive up your blood pressure. So I don't want you to come back and say, I eat everything gluten-free. I'm not really sure why it's so high. That's why. So on this topic, I always want to talk about sodium because people ask me all the time, can I have salt in my food? Can I not have salt in my food? So let's kind of determine what we mean by sodium. Sodium, you see it on the ingredient list on food. It is very, very high in processed food. That's different than the salt that we add to our food with a salt shaker. Let me tell you what I mean. We need around 2,000-ish milligrams of sodium per day. And people with blood pressure, less than that. But the average American consumes about 3,400 milligrams a day. To put that into context, and that's from processed foods. To put that into context, a half a teaspoon of salt is 500 milligrams of sodium. So you would need to add 3 full teaspoons of salt to your food all day long, just to your plate, not to, if you're making a pot of soup and you put it in a big pot, that's okay, right? Because you're only getting part of that. You would literally have to take 3 full teaspoons of salt, add it to your food daily to get to that number. And most people don't do that. So if you're cooking at home and you're eating whole foods, nothing out of a box, nothing that has words that you can't pronounce on it, nothing that has like sodium in the ingredient, you're just cooking your meat, your vegetables, you can go ahead and add the salt that you want. It's not going to add up to the amount of sodium used in processed foods. That's really important because people are omitting the salt shaker and eating tasteless food, and you don't need to do that. Okay. If you're just adding salt to your food, whole food, it will not add up to the sodium in processed food. Okay. I wanted to take a moment also to explain why exercise lowers blood pressure. People talk about, that you need to exercise, but why? Why does exercise lower blood pressure? In fact, in the moment, you might be feeling like it's high, right? You're super energized. How does it bring it down? So if you Google it, it'll say it makes your heart stronger, but that's not really it. When I'm talking about, by the way, when I'm talking about exercise, I'm talking about 30 minutes of movement. I don't mean to go on a CrossFit max challenge. 30 minutes of movement. Everybody's movement looks different, right? Some people it's walking down the block. Some people it's going down the driveways. Hi, Ashley. And then some people are, going to a max challenge or to a marathon, whatever your movement is, 30 minutes of movement. The reason it works is because it improves the inside of the pipes, what we call the endothelial function. The inside of the pipes, there's a lining inside the pipes. And when we exercise, we're actually improving that lining because we increase a chemical called nitric oxide. And exercises helps you release more and more of this NO, which loosens up the pipe, heals the lining inside, and allows the blood to flow more freely. And that happens immediately. Like as soon as you work out, that happens. So you have an immediate relaxing of your vessels, opening up, a dilation, and a calming down and a reduction in blood pressure immediately from workout. It's not something that takes, weeks and months to build out. So the more that happens over time, the more you exercise, the more often it happens. But the other thing that happens when you exercise is because when you exercise, you need more blood. You need more supply. You exercise and you need more. So your body actually starts to make more vessels. It's a process called angiogenesis. Okay, so it actually creates more little micro vessels all throughout your body to allow for more outlets to get to the areas that need it. Because exercise, again, not to get too technical, it releases another chemical called VEGF, vascular endothelial growth factor. And so between those two chemicals that are released when you exercise, there is so much happening to the plumbing every single time you exercise. I want you to know that. So think about it next time you're like, I don't want to get off the couch. You're like, well, I really want some nitric oxide and some VEGF. I'm pretty sure it's good for me. And maybe that'll get you off the couch. Maybe not. I'm not sure. So here's the bottom line. Blood pressure is dangerous. It can kill you. But before it kills you, it will cause a lot of damage to your heart, to your brain, to your kidneys, to your eyes, to your sexual function. It will cause a lot of damage. So it is really important that you get ahead of it. First thing you need to do is get it checked, find out, get diagnosed. And if you have it, you must treat it. Do not ignore it. And if that means you want to take medications, that's okay. And then if you're taking those medications, make sure you go get it monitored, make sure that you're hitting the right numbers, be consistent about it. But if you want to get to the root cause, you're going to want to start with whole foods diet, nutrition, get rid of the processed foods, start to move, whatever movement looks like for you, manage your sleep apnea, take omega-3, take magnesium, take vitamin D, and get ahead of it. I hope this helps. As always, if you want to work with me and my team, of course, I didn't press any of the buttons, but if you want to work with me and my team, this is how you reach us at The New Method on every platform. Everywhere you send a message, my team will answer you. I look forward to hearing from you and I hope this helps because you always knew there was a better way I'll see you guys next week.